Hi, my name is Aaron Silva, and this is the final project for Psychology of Injury. I decided to do case number three, which is an 18-year-old Hispanic female swimmer with a history of bilateral compartment syndrome presents with bilateral calf pain. She had a vasectomy surgery on both calves in 2017, and the pain feels very similar to the pain she experienced before surgery. Following that surgery, she experienced an infection and substantial pain as a result. She was left with profound scars on her lower leg. She's a freshman in college and earned a full scholarship through the swim team. It is the middle of her first season, and she has been very competitive to this point. She feels the physical workload is much higher than high school and feels sore all the time. She feels as though her condition is becoming worse and she is unsure if she should report the pain to her coach. She's a first generation college student and the first of her family to move away. She lives about 4 hours from her family. She has a heavy course load and is studying biology with intentions of going to medical school one day. She finds the pain distracting, especially after morning practices, and leaves her unable to focus during classes for the rest of the day. She also finds it challenging to climb the stairs to her dorm room. She takes medication for anxiety and heartburn, but otherwise she's healthy. Um, so, questions that I would ask this individual to help me understand their situation is when was her bilateral compartment syndrome diagnosed? I would ask her how the pain was on a scale of 1 to 10 before the surgery, 1 being little to no pain, and 10 being the worst. How I would ask her as well, how has your mood changed since becoming a collegiate student athlete? How would you rate your pain currently? Is there any other outside source that may impact the worsening of your injury, excluding the activity of your sport and school? Do you think your anxiety and heartburn medication may have a side effect to your current injury? Um, Several factors that may positively or negatively have a response to their injury. I put really, it's kind of hard to find positives. The only really positive thing I found due to having an injury is, having a full ride for college, for swim and academics. Especially with a pre-existing injury, it's hard for anyone to get a full ride, especially for swim. I guess a positive thing as well is she's a first generation student in her family, first to move. So it shows that she aims higher than higher goals than her family had. Now, I did list a lot of negatives because this does seem like a negative concept. It's sad to think that way, but this is how I see it. Um, there's definitely a negative response. So the previous surgery, because the pain still feels the same even before getting the surgery. Being 4 hours away from home because as a freshman, her strongest support system is probably her family at the moment. Which, like I said, she's 4 hours away. She's not used to the increased physical workload due to moving from a high school athlete to a collegiate level athlete, meaning more physical activity is required. Um, Heavy course load due to having a difficult major, which is biology, and wanting to go into medical school one day. So I know that's a lot of work for a student, and especially, it could be um, a huge toll mentally. Heavy course load, like I said, oh, having a hard time walking up the stairs due to the pain in her calves, which is a very simple task. But even then, if something simple as that means that her injury is pretty bad. Anxiety and heartburn medication, like I said, could have side effects impacting her performance in the pool and classroom, especially anxiety medication. I know sometimes that can maybe increase medication, but there's no side effects listed. Um, uh, Her only injury history is history of bilateral compartment syndrome, and then presents with bilateral calf pain with the surgery on both calves in 2017. Then after the surgery, experienced an infection and substantial pain as a result. Um, the injury type, it's definitely a chronic injury because it seems like she's had it more than 6 months and has pretty much almost consecutive pain almost every day. Severity seems pretty severe due to the pain of a simple task walking up the stairs to her dorm and being unable to focus in class. So something small like like I said, a simple task, walking up the stairs, and something small like just paying attention in class. If the pain bothers her that much, it's shown that it does take a huge toll on her mentally and that it's pretty severe. Um, there's many ways that she can respond negatively because maybe she doesn't want to lose her full ride scholarship, holding back from telling her coach due to probably she wants to compete. You know, she doesn't want to be taken out. She wants to succeed in school. Like I said, she's majoring in biology and wants to go into the medical field. So knowing that makes a huge impact. Um, Probably not be able to swim to her full potential due to the severity of her injury. She may become depressed because of how much it's taking a toll on her physically and mentally. Anxiety medication can have a major side effect on mood and state as well. Since she is far away from home, she may not have a stable support system yet. Um, Group communities, populations um, that she's a part of. I know that she's part of the Hispanic community, a student athlete community, the biology slash medical field community, and the swim community. The impact of being in multiple communities, um, especially a student athlete and a biology slash medical field community, uh, can give her a negative response to her injury because swimming takes a toll on the body very physically. Being tired for swim can also impact her mentally in the classroom, especially as a biology medical field major, knowing that the workload is a ton. This can impact her sleep as well, not being able to sleep due to the pain and possibly stress. That can actually increase her anxiety, which may require her to take her medication, or even if the anxiety comes to a point where her medication doesn't work, she probably has to be prescribed as a higher dosage. In order for her to communicate effectively based on the information that was given and maybe some assumptions that I could get out of this information, these are some strategies or techniques I would recommend. You know, especially first letting her coach know that she's injured and she think it may take a toll on her performance in swim and in her academics. She should also see what she can do for rehab or ways to relieve the pain for her calves. Um, I think she should seek professional help from a therapist if her anxiety increases so that she's able to talk how she's feeling and what may be making her feel overwhelmed or feel this tired, which, like I said, it's possibly due to high workload and uh, her pre existing injury. Um, Factors that may have predisposed this individual to their injury. Like I said, a lot of these repeat. So she has a history of bilateral compartment syndrome, which makes her have bilateral calf pain, her surgery in 2017, and then an infection resulting in pain. Thus, already having a toll on her mentally and physically going into college. And increased pain and stress once going into college due to the heavy workload in the pool and in class. Measures that I would use to assess this individual's stress level based on information given to me. I would probably use the affect mood state to evaluate her mood every day to see how she's feeling and how much stress is taking a toll on her. I think it's good for her to take this daily or maybe weekly to see how she's feeling, how often she's feeling. You know, is this having a more negative impact than it is positively? Um, does she need to take a break? Does she need to be out of the water? Any of that stuff. Um, Intrinsic or extrinsic motivation this person has. Definitely intrinsic is, you know, pushing past it mentally, thinking it's all mental. So, for example, stress, anxiety, you know, the pain of her calf, those are all intrinsic forms. And maybe she wants to mentally push past it and say, no, like it's okay. But really, it's going to take a toll on her physically. Extrinsic, you know, her schoolwork, swim practice, scholarships, you know, her family being far away from home, surgery, hard to do simple tasks like walking up and down the stairs. Maybe motivation they have is, you know, since they have a full ride, they're going to do as much schoolwork as they can. She's going to swim practice as much as she can. Being far from home, it does show that she does live far. Like I said, she's the first to move out of her family. Um, Maybe overthinking that simple tasks are too uh, too hard, even though they shouldn't be for her. Forms of social support that they may have, and that may be present based off of like previous information. It does not really show if she has a social support, but assuming that her strongest social support is far from her, which is her family. I would also assume that her social support would be her teammates, but since she is a freshman, they may not be a super strong support system just yet. Um, I know that they're in physiological distress, um, because it shows that she's having a hard time focusing on her academics and that she's taking her anxiety medication. I would refer the individual whenever she feels like she's ready. I do not think forcing her to go to any professional help with anything. I would wait until she's comfortable in making a decision about what she wants to do. However, I do think that her coach should try to also keep a close eye on her just so she doesn't fall into a depression state due to this mental and physical toll. There are two providers I would recommend for her, which first off is physical therapy for the pain in her calves and possibly counseling to talk about how stressed she is due to the impact of a high workload of swim and academics. I personally think that she would be adherent and complaint to rehabilitation because of her concerns about her pain and how badly she still wants to compete. It does say that she is super competitive, and you can tell that she does well because she got a full ride to college. Based off of her full ride scholarship or competitiveness in the pool, she seems to be the one to do anything and everything to be able to return and do well both in swim and academics. I would encourage her by letting her know that this is going to be a process, but if she does it correctly, she could be on track or even ahead on the road of recovery. Questions I would ask when they're ready to return to her normal activities. This is how it would assess. I would ask the same question. I would ask one of the same questions in number one, and then how would you rate your pain now? Again, a scale from 1 to 10, 1 being little to no pain at all, 10 being the worst pain. I would also revise some questions asked. Are there any outside sources that may have an impact to worsening your injury? Again, excluding activity of the sport and school. And then how has your mood changed since post injury recovery as a collegiate student athlete? I would still use the affect mood state test to evaluate her mood post injury recovery, also to reevaluate her range of motion. Also, I would reevaluate her range of motion to see how she's feeling doing certain activities before continuing her sport. And that is the end of the case study that I chose.